I find it hard to be just a patient, and sometimes I do want to be somebody that knows nothing, because there's a lot of this that I know nothing about. You can be role-playing with doctors for 30 years and still not know quite a lot. So this, for me, was interesting, trying to let go of some of that, but realising actually the bit that observes is not me as a senior lecturer or whatever. It is me as a person. I observe people, and therefore the joke about, you know, before the CAT scan and after the CAT scan. But actually I do. I love to see people and to see how their little ways really help. So I have one chap who is always there when I have a CAT scan, and he's just amazing. We walk along the corridor and I give him my arm and we sing together, and he says, "Oh, you're back again," you know. And he does it in exactly the right way that feels perfect. And I had another young chap recently who tried just as hard and really thought he was getting there, but missed it every single time. Now, the wrong bit of Jerry would go and say to him, "Now, would you like some help with this?" But I didn't, you'll be pleased to know. But one day I will, because I do believe that patients should give feedback, and the other way around as well. When professionals think either their patients are perhaps not having the opportunities to talk as they would like to. But just little tiny things, like if you're going into the MRI and somebody says to you, "Please, can you put the trolley in really slowly, because then I won't panic. But if you do it fast, I will." And they listen to you and they say, "Okay, Geraldine, we're just about to do it. Is that all right?" It's amazing. And at the Macmillan Centre, every scan, and I've just had loads of them, they all do the same thing. "We're pushing you in slowly. We're injecting the dye now," because I've asked for both of those. I am completely relaxed. I've never been relaxed having an MRI before. And funnily enough, the reason I'm not relaxed is because one day I was pushed into it and I didn't know where I was going. But I've also learnt that it's a two-way thing, that lots of healthcare professionals don't start conversations, they wait for you. I think partly because they've been taught, perhaps we've taught them at times, to go at the pace of the patient, but not all patients know that they're waiting for that, and therefore that can end in a bit of a conundrum. So I suppose what I've learned is, if I do want to know something, that I do ask just in case. And different people have different ways of dealing with that as well. And some people are really, really good doctors. I mean, I have seen 3 consultants and they are all wonderful. And I would choose to be under any of them at any one time. But they have very different communication skills. One I've told you about. He has a real warmth about him. He's also very matter-of-fact. You wouldn't be too sure whether to call him doctor or, until of course I ask, but you know, you're just not too sure, but there's a warmth there, and so you would ask the question. And he's, I think, probably quick to grasp how much you can take on beyond that bold statement. There was another person I saw who, also a man, who seemed to me just a little bit more nervous when it was questions like, "Come on then, how much longer have I got to live?" It was like, "Oh, I'll look up in your notes," rather than, "That'll give me a few minutes to get my thoughts together and tell you whatever." Delightful chap, and really very, very good at his job, but needs a bit more thinking about, is it right for him to say that, because he doesn't know. So then I had to help him say, "I'm not looking for 100%, I'm not even looking for 90%. In your professional opinion, with the tumour that you know now what it looks like, age, all that stuff, how long would you say most people would live for? That's all I'm asking. I'm not asking for me personally, just a bit of stats there. And he was more able to cope with that. And then it was almost, you could see a sigh of relief. And then another person, a woman who was very professional, also very friendly and very open, but I was a little bit more scared of her. Because I wasn't sure how far I could go. I wasn't sure if I could joke with her. But then I'd almost decided I couldn't joke with her and I couldn't ask her questions. And I really, by that time, did want a prognosis. Not a fully fledged one. Come on, are we talking 3 years, 6 months, whatever? But when I asked the question, and she had no qualms about answering it, and that's where I heard it was months rather than years. And I purposely went to kind of, it could be 3 years, and knowing that it almost certainly wasn't, but to give her that freedom of, that's way off, you know. So again, all the warnings that everybody else had given me about can't be definite. You know, miracles happen, so-called, but here's what I think, and that was brilliant. I've met quite a few nurses now in the hospital and outside with the Macmillan team, and again, couldn't fault them. Some don't listen enough, but are there with you in other ways. I think some people do have a set vision in their head of what patients will want and ask. So it was a while before I'd cottoned on that everybody thought I'd retired, I think. And I thought, gosh, how did that happen? And then I suddenly realised, gosh, you know, this used to be something that I used to suggest that doctors ask about working, and are people happy working, rather than make assumptions. And one day this person was saying, I really think you should apply for this benefit or whatever. And I said, no, I don't particularly want the benefit. I'd love to know it's there when I need it. If it's going to take 10 weeks, perhaps I'd like to speed that up a bit. What I want are two things. One is to keep working, and one of them is a blue badge. And you never guess how difficult it is to get a blue badge unless you're almost dead or have any number of the other illnesses that count. But in this case, it was just, again, one of those ironies of having cancer, that there's a fast track scheme, and it is for people with what's the phrase, life-shortening or life-limiting conditions. But then you find yourself in this weird position of you and your consultants arguing the case for how long you'll live, having then everybody tried to make sure that you live a long time. It's now, well, perhaps not, you know. You could actually say you couldn't, and that would be the truth, and actually that will get you a blue badge as well. So again, it's these strange juxtapositions that go on. But yes, the nurse was, I think, a bit shocked that I really wanted to carry on working, but then came to her senses, thankfully, and realised that, of course, you'd want to. If you get that much satisfaction from it until you're ready to stop, we'll do everything we can to keep you working. But again, it was once I'd started talking about it, I found I had a theory, and I think they must get very fed up with it in the Macmillan Centre and in the hospital, where we all say how lovely the Macmillan Centre is, and it really is superb. I've never seen anything like it. But I was unfortunate enough at the weekend to be taken into the main hospital, and I could not have faulted the staff on A&E, from the reception to the triage nurse to the A&E consultant. Everybody was as you'd expect in a top-notch hospital. fantastic. I mean, people talk about going private. Well, I don't agree with private anyway, but you couldn't get that on private. This is people really understanding what it's like to be in hospital or to be with the threat of being in hospital. So I think probably quite a lot's been done for education, not just of doctors or nurses, but everyone. Do you know one of the best communicators I've found is the pharmacist? He's absolutely amazing. I feel I could pick that phone up to him any time and say, could you just go through this again? I know you've told me 6 times over, but which pill do I have with which pill? And he would do that slowly, accurately, and hang on, why are you taking that then? What, do you remember the bit of paper I gave you that said take that then? All quite calmly, all was as if my whole case history is in his head, which is pretty some going. Well, that is where the anger came in, but then I found that actually it was me that was getting angry with them, because there were a couple of people, a couple of nurses who, and in the end, dare I say it, a couple of my friends, who were beginning to talk about these words about being in denial. First of all, I gather talking to each other about it, but then to me, they wouldn't use that word with me, but they would say, you know, you are allowed to be angry, you know. And I just wasn't angry. And so then when it continued, I then started getting angry with my friends, saying, look, what would stop me being angry? I'm not angry. I'm sure that if I hadn't had the care that I have had, I would be angry, because you're anxious that you do get the best that's on offer, whatever that is, for everybody. But I've had that. I've had a good life as well. And so although I don't really want to go at my age, I've had a good innings, and I couldn't have wanted anything more. Perhaps to see my granddaughter you know, a bit older, but then I want her a bit older, and then I want my daughter a bit older, and it would just go on and on. But once I really talked to my friends and said to a particular nurse, really, I am not holding anything back. If I don't cry, it's because I don't want to cry now. If I don't talk, it's because I don't want to talk now. But if I do, I feel absolutely able to. Anger doesn't come into it. Sadness, absolutely. Sadness for all sorts of things, but anger and sadness are very different things in my book. So I didn't want that as an extra burden, really, of people twittering on about how I should feel. And by this time I should feel this, I should feel that. As with bereavement, that's not helpful to have, you know, the 12 stages of. They probably are in general terms, but there are individuals within that. And some people go to 12 before they've got to 1. And it's perfectly all right.